Hi, my name is Dr. Janet Stoess-Allen. I'm an orthodontist in New York. I want to share today with you some of the cases that I treat with Invisalign. We really specialize in Invisalign in my office, and now we're really focused on treating a lot of teenagers with Invisalign with the product called Teen Invisalign, which is wonderful for teenagers because they don't have to wear braces anymore. There are very few, if any, emergencies. There are no wire pokes, they can eat anything they want, and everybody's just a lot happier. So I'm going to focus on a couple of patients. One of them is completely finished. The second one is still ongoing. The first one both of them have crowding, but the first one also, in addition to crowding, has a crossbite. So let's just focus on these two patients. The first patient is here. You can see in the anterior there's a crossbite here, there's a crossbite in the back. The upper dental arch is obviously very narrow on the sides. You can see that in the finish we completely corrected it. So on one side you're seeing what actually happened, on the other side you're seeing the virtual start and finish that comes to us from Invisalign. I think we typically exceed Invisalign's expectations of how we're going to finish. So you can see here that everything looks beautiful. In this shot, this is the same patient. We're looking at the upper arch before treatment, so you can see how it was very narrow in this area, and now it's a nice broad U shape, and that's how we were able to correct that semi-anterior open bite and crossbite that we had. So you can see the virtual beginning and the virtual end. There was also some crowding. Let's move on now to the second patient. This patient is still ongoing, but you can see when she started treatment, her teeth were extremely crowded. This is the virtual from Invisalign. You can even see how the tissue is looking much better from what Invisalign's predicting in the actual photographs. So she's actually going through treatment still. She's still got attachments on her teeth to allow us to fully exhibit the treatment that's planned for her. And you can see that she's moving along really nicely. In this shot, you can see the same patient. This is her upper teeth showing the crowding that she had. You can see how she's looking as we're going through the treatment currently. And we'll also show you the lower arch, and you can see that she was crowded on both the upper and the lower arch, and how things are really straightening out for her. So I think the important thing to take away from this is that teenagers now don't have to be treated with traditional braces. We have Invisalign Teen, and it's extremely effective, and teenagers happen to be some of our very best patients. They cooperate fully. So if you're in the market for Teen Invisalign, give us a call, 212-452-2777.